Back to that story that Gareth was alluding to earlier on. Our COVID-19 vaccination program is currently underway, and many a times we've heard the phrase herd immunity. But what does this actually mean? Is it really possible? And if so, how long will it take for us to even get there? Professor Shabir, Madhi, Vaccinology and Director of the Vaccines and Infectious Diseases Analytical Research Unit, this at Wits University, shed some light on these questions. Prof, thank you for your time and good morning to you. I suppose that is the question. What is herd immunity, I suppose, for clarity and understanding? And also, are we even possibly getting close to it?
Good morning. Thank you for having me. So when we refer to herd immunity, what we mean is that there's, in the community, almost everyone has become resistant to being infected with the virus. So there's very few people that are susceptible. And consequently, even if there's an imported case of COVID-19 as an example into the country, that person that is infected wouldn't be able to pass it onward to other people simply because other people have developed a resistance against being infected. And the way we usually get to herd immunity is through vaccination. But that is not the goal of vaccines. Vaccines are not to get to herd immunity. That is a bonus of vaccines. The main reason vaccines have always been developed is to prevent severe disease and to save lives. And that is a central focus. Based on the recent experience from the United Kingdom as well as Israel, countries where more than 85% of the adult population have already been vaccinated, those countries recently faced the resurgence because of the Delta variant, clearly demonstrating that even when more than 65% of the population were vaccinated, they didn't reach a herd immunity state. Because had they reached a herd immunity state, you wouldn't get this sort of resurgences, and essentially there wouldn't be many new cases of COVID-19 that materialize. So where we currently stand is that these vaccines work really, really well, all of the vaccines for that matter, against almost all of the variants that have been identified to date. But these vaccines are much more variable when it comes to protecting people against being infected and developing mild disease. And it's extremely unlikely that these vaccines in its current form would actually result in any country, for that matter, reaching a state of herd immunity.
Right. Prof, with that being said, we have seen the evolution of this virus with different variants. What challenges do these, mushrooming variants pose to the efforts in curbing COVID-19? I mean, I'm sure you know so many of them besides the Delta and the Beta variants that we continue to talk about even as media. But what challenge do they pose, do you think, to the efforts that you're making as a health fraternity?
So, like I said, it really depends what the goal of vaccination is. When it comes to protecting against severe disease, these vaccines have been shown to be resilient and have been able to protect against severe disease across all of the variants of concerns, because the type of mutations that are taking place in these viruses is not what is allowing the vaccines to stop working against severe disease, because the vaccine has a different approach with regard to the type of immune system that it induces, which is required to protect against severe disease. So these variants of concern are of concern, but less so when it comes to how well the vaccines will protect against severe disease, but much more so when it comes to how well the vaccines will protect against infection and mild illness. So again, an important reason why it's extremely unlikely that we would reach a state of herd immunity, because the virus is likely to going to continue mutating, become relatively resistant to some part of the immune responses that's induced by the vaccine, which won't prevent get the vaccines to work too well against preventing infection, but that wouldn't diminish the ability of the vaccines to protect against severe disease.
All right, so Prof, so to minimize expectation, should the conversation shift from talking continuously about herd immunity to how we actually live with the virus?
Absolutely. For all intents and purposes, we should abandon the term herd immunity in the context of COVID-19, at least for the foreseeable future and probably during the course of our lifetime. It's about learning how to live with the virus. And the best way we can learn to live with the virus is to ensure that people are protected against severe disease. And the most sustainable manner in which we can ensure that people are protected, or the vast majority of people are protected against severe disease, is to ensure that we get as many of the adult population vaccinated as quickly as possible. We probably need to vaccinate about 80 to 90% of the adult population, and that would basically put us in a good state where COVID-19 might still cause resurgences, but we wouldn't experience the type of mortality we currently experience and the number of deaths that occur each year wouldn't be dissimilar to what we see for seasonal influenza, if not less.
All right, we'll leave it there. Thank you so much, Professor Shabir Madhi, for joining us from Wits University, talking about the importance of rather shifting, I suppose, the narrative and conversation from herd immunity to living with the virus, how we can safely do so, continue to, adhere to COVID-19 protocols so that, of course, we protect each other as well as our loved ones. Thank you for your time.